A senior research fellow with the Kumasi Center for Collaborative Research is warning of an upward trend in COVID-19 cases in the Ashanti region. Speaking on PM Express Tuesday, Dr. John Amoisi said a lot more of the youth are getting infected according to the latest numbers. He is warning the country will be badly exposed if the new highly contagious variant makes its way into the general population, and is urging the Ghana Health Service to strictly enforce testing and quarantine those who test positive.
The manifestation of the third wave is very critical. In the UK, one could argue that they are actually in another wave of sorts, albeit maybe a fourth wave. But what's happening is that it's not going to impact on the hospitalization rates and the death rates. It's the infection rates. So what does it mean for us here if we are in a third wave? For me, it means that the risk of severe disease and ultimately hospitalization and death might be high. If you look at the numbers in the Ashanti region, it's already going up. We're doing some work, right, for which we need to do some pre-screening. And I can tell you that over the past 2 weeks, we've seen a significant rise in the numbers of positives that we're seeing. We did a pre-screening and half of those who pre-screened were positive. All right. It's really interesting. And I actually told my team that just wait till next week. And it's exactly happening as I had predicted, because, you know, the science doesn't lie. It's just like, you know, it's just what it is. It will happen. All right. And it is happening. So what this means is we need to be really careful. And if you watch carefully, it's exactly the same picture. It's the younger population. It's the younger population. Because of where I sit, I get many calls from people. Oh, I'm not feeling too well, so and so and so. So you send them for testing, you find out it's positive. And then you just have to make sure that they're isolated and so on. So,
well, residents in Kumasi have appeared unperturbed by the warning. Some of them, Joy News has been speaking with, say that media is exaggerating the issue.
There's nothing I'm doing about the safety protocols. Me, for instance, the way the media were preaching about this coronavirus pandemic, nowadays I've not been hearing it. So me, I think it is gone for good, and there's no way it will come back. I heard the Ashanti region, we are leading. When you will see our attitude, the attitude of the people in the Ashanti region is very bad. Though it is not gone it is not gone. But the way, especially when you sit in the trotro and the taxi, people are not wearing their nose masks.
The Ashanti region, we are having a problem because of the political interference of the district. Because recently, when the St. John burial, and a lot of people are making a lot of comments that if the president will be making all the necessary about to wear the face mask and all this, and then they themselves during the funeral there is a lot of things happen there, and then because of that, a lot of people, then you can't be communicate to some people who are not wearing it, because when you try to let them to use what you are doing, they are trying to refer you to the politician.
Coronavirus, I said, instead than you say coronavirus be never hand. Because here abrofun, on a coronavirus started free by you. The Euros see on mobile, when you pay good stadium, you did ye. Now I had to Ghana the coronavirus be concluded. I mean, they say, and when you phone discadi, oh, abrofun on Salam because here. We are not adhering to the protocols because we are tired of them. Every day there's new virus. Every day there's new virus. We don't know what to do again. We are tired of them. They should come and kill all of us. We are tired of them.
All right, so we'll be speaking with the Ghana Medical Association in a bit, but I just want to share with you the latest COVID stats on the Ghana Health Service website. So we have 52 new cases and 1,301 cases, which actually indicates an uptick. that the trend, it's trending upwards. And if you look at the regional distribution, 929 active cases in Greater Accra, 155 active cases in the Ashanti region, where we've just been speaking with some of the people there. The total confirmed number of cases, 95,236 and 794 deaths. Then we also have 93,141 recoveries and discharge. So clearly, this is worrying because we're seeing an uptick in the numbers. Now, the Ghana Medical Association is also worried about the implications of the new highly contagious COVID-19 variant finding its way into communities in Ghana. Joining us is Deputy General Secretary Titus Bayo. Thank you very much, Dr. Bayo. Now, KCCR says it is seeing an upward trend in COVID-19 cases in the Ashanti region. What has been the GMA's own observations as far as COVID-19 cases are concerned?
Good evening, Israel, and good evening to your viewers. I think the trend in Ashanti, we picked up signals a bit earlier, somewhere last week or even the week before, that the cases were beginning to inch up. At some point, the Deputy Director of Public Health for the region actually made a statement to that extent. When they were recording about 20 cases a day, and at some point it went up to 39 to 40 cases a day. So it looks like, yes, what KCCR, which is the testing center, is reporting is what the case is. Hopefully, we are hoping that what they are seeing is not the Delta variant, because from the data available, it looks like most of it, the Delta variant, is being picked at the airport. Whether it's filtered into the community, we are not sure yet, and we hope that it hasn't. And listening to your sound bite from Ashanti, it's very disturbing, but truthfully, you can't begrudge them, because they are speaking based on what they are seeing. And these are the very comments that the Medical Association expressed on some of these situations. And it looked like people didn't take us seriously. If you take, I don't know if I can respond to some of them.
But before you respond to them, I'm just curious, where do you think we're getting these new cases are coming from?
No, you see, the way this disease spreads is exponential. There's something we call the attack rate of the disease, where even if you have one person and the person doesn't obey the protocols, it spreads. So what had happened was that we had an intense use of our protocols, wearing of masks and all, so the virus could not move from person to person. Let's not kid ourselves. Our immunization is not a major response that has brought down the trend that we saw from January, February. It's mainly because there was heightened awareness. People were afraid when they were seeing that our hospitals were getting full, and the media was up there making a lot of campaigns on it. So because of that, people started adhering to the protocol. That helped us to control the disease. Now we have gone down on these protocols. So it's just normal that a few people who have got this condition at the time will begin to spread it. So I'm not sure the trend we are seeing is because of new importation, in particularly in Ashanti, but it's because there is total disregard for the protocols. Just go to Kumasi for a weekend and look at the funerals, look at the activities that are happening, and even in Accra here. So that is what is accounting for the trend that we are beginning to see.
All right. Now, there appears to be some fatigue among the general population, and this is coming to the sentiments we've heard from the region when it comes to the COVID-19 protocols, which is apparent from the people we've been speaking with, who cite the disregard of the protocols by persons in authority. It is a setback to all the work that has been done. How do you suggest we address this challenge?
So, definitely, fatigue in adherence to protocol is expected. What we are doing is not the norm for us, and therefore, when you do a new thing over time, it becomes difficult for people to adhere. That is why there's a need for enforcement. Release after release, the Medical Association has pleaded with the law enforcement agency to enforce it. You have to help the citizens to protect themselves. Definitely, people will get tired. Nobody is comfortable wearing masks all the time. Nobody is comfortable not hugging people, not meeting with people. It's not the norm. So unless you enforce it, everybody will get tired with it over time. But knowing that we have a challenge, then you have to try and enforce the protocols to protect the citizens against themselves. So if you ask me how are we going to go about it, I think it's enforcement. And then those we see as leaders, political leaders, various influencers on social media, media houses, all of us must be seen to be doing the right thing. Then people get to know that everything is, we are not out of the woods yet, and they have to adhere to these protocols. I heard people citing the ongoing Euros that is going on. They are saying that the whites are not in masks and all of that. Ask the vaccination status of these countries and look at the stadium that is being that are used. What is the capacity of the stadium and how many people are in there? And almost all these people have been vaccinated already. What's happening in our country? What percentage of our population is vaccinated? So we really cannot look at what is happening out there and bring it to our system. Our healthcare system is nothing compared to theirs. Now, if you come to some of the comparisons they were making about the political class not adhering to these protocols, we mention it. And I think sometimes the media need to follow it up. When the activities of Sir John Smith now occurred, the GMA issued a statement. We heard political commentators saying we should wait and see if there will be rise in the cases. I think we should call back some of those people and let them explain why they are rising in the cases. It may not just necessarily be Sir John's funeral, but there has been a trend that has been demonstrated to everybody that, look, the person telling us to wear the mask are not taking it serious anyway. Maybe there's some information that they know that we don't know, or this disease is even gone. And you could hear someone say that there's no COVID in Ghana. The thing is gone. It's that our leaders are trying to take money from donors. That's why they are saying this disease is there. That's a very unfortunate thing. Have we not seen people who have died from this condition? We have. So we cannot say that this is a mystery. There is nothing like that. It's unfortunate. But it's because those we hold high, those we rely on, our leaders are not showing us examples.
Right. Right. Thank you very much, Dr. Titus, who is the Deputy General Secretary of the Ghana Medical Association.